Hello, everyone, and welcome to the first episode of the Ladies College All-Girls Association Pulse Series. This is a series to educate our members on compelling and timely topics. Today's session is in collaboration with Lanka Hospitals, and we're pleased to have with us Dr. Mrs. Chalukya Gunasekara, consultant dermatologist, to speak to us on a very interesting topic, which is female hair loss. Thank you, Dr. Gunasekara, for being with us here today and for being part of this initiative. So to get started, Dr. Gunasekara, could you explain to us what exactly female hair loss really means?
Okay, so female hair loss, or on the whole hair loss in anybody, the correct medical term for this is alopecia. Now, there are many causes for alopecia. Basically, we are talking about loss of hair, mainly from the scalp. However, even loss of hair from the body or the eyebrow, all these are called alopecia. It's just a common term for hair loss. Now, this hair loss can sometimes be permanent, sometimes it can be temporary. There are many underlying causes for this. Also, when the hair becomes thinned out, when there's shedding, excessive shedding, all these also are referred to as alopecia.
So, Doctor, you mentioned that hair loss can be temporary or permanent. Could you explain to us a few key signs of hair loss?
So sometimes people may notice that they're shedding a lot of hair, they find a lot of hair on the ground. Sometimes they notice that the hair is loose. When you do pull on your hair, that there is some loosening of the hair. Sometimes they may notice bald patches. Sometimes you can also have some scalp disease visible along with hair loss. So these are some of the signs to watch out for. But often actually ladies come, they come without even having to look out for signs of hair loss, because with the slightest increase of hair loss, I think people just come running. So it's not something that you need to really constantly watch out for.
And with that, Doctor, could you also touch on what the key cycles of hair growth are?
Right. So this hair growth on the scalp is very complicated because hair growth grows in a cycle. And remember, each hair, adjacent hairs may be in different parts of the cycle. So if you look at the diagram I have done for you, there are 3 phases for the hair cycle. The first one is called the anagen phase. The majority of hair on the scalp is in this anagen phase. In fact, about 85% of a person's hair is at a given time in anagen phase, where there is growth of hair. The hair is generally growing. So the second phase is the catagen phase, where the hair stops growing completely. This lasts just about a couple of weeks. Then it goes into the third phase, which is called the telogen phase. And this can last a couple of months, actually, up to about 3 to 4 months. So different hairs are in different phases, and they are never synchronous.
Having touched on the types of cycles of hair growth, Doctor, could you also explain to us the types of hair fall women may experience?
Okay, so going on from these the hair cycle phases that I spoke about, some of these hair losses can affect the anagen phase. Now, this is the kind of hair loss you find after cancer chemotherapy, where the growing cells are directly affected by certain cancer drugs. Then sometimes it can be affecting the telogen phase. That is called telogen hair loss. That is the time where the hair goes into sort of a resting phase, and that phase can be affected in many of these after many infections, illnesses, any event in your life which has had stress in your life can cause telogen hair loss. Now remember, because the telogen phase lasts about 4 months, whatever event that affects the hair cycle will not show up immediately. It might take about 1 to 3 or 4 months for the hair loss to show up. So the event that affected the hair loss may have occurred 3 months ago, and you may not even really tie it up with your current hair loss. So sometimes patients find it difficult to fathom why, after certain viral infections, for instance, even COVID or even dengue, you get your hair loss actually after a couple of months, after about a gap of 2 to 3 months. And this is because it affects the telogen phase of the hair. Also, there can be patterned hair losses.
And just like the common causes of hair loss, doctor, are there any uncommon causes of hair loss that women should know about?
Yes. So there is this condition called alopecia areata, where your own body turns against you and forms antibodies against your hair-forming cells. These are what we refer to as autoimmune diseases. Now, there are two patterns of this alopecia areata. One is called localized alopecia areata, where you get just patches of hair loss. Most people just get one patch, but sometimes you do get a couple of patches as well. But the scalp itself looks completely normal. You just get it happens sometimes overnight. You just get a bald spot with the scalp looking completely healthy. Or alopecia areata can occur in a more diffuse manner. So it comes under the category of diffuse hair loss, which I spoke about previously. So there are two patterns of it. This is not common, but we certainly do see these patients, and this condition particularly affects younger people. So lots of young, both males and females, present with alopecia areata. Now then, there are these very serious conditions of the scalp, which cause what we call permanent alopecia, where there is the disease, where there are diseases, certain diseases, dermatological diseases, which can affect the scalp, which causes so much of destruction that the hair will never grow back on those places. So again, they also mostly present with bald patches, but along with the bald patch, there is the skin on the scalp doesn't look healthy. There is sometimes scaling, sometimes there is a very tissue papery, shiny looking scalp on the patch. Two conditions that come to my mind are what is called discoid lupus erythematosus, which can be part of systemic lupus erythematosus, which is a well-known autoimmune disease, especially in females. Or there is another skin disease called lichen planus, which can also affect the hair, called lichen planopilaris. These are uncommon, but just for completeness sake, I'm mentioning these. Then certain infections on the scalp also can give hair loss or alopecia. Certain fungal infections. There's a condition called chirion, where there is a very, very florid fungal infection which occurs on the scalp, particularly seen in children. That also can be a cause of permanent alopecia if not treated quickly. Okay, so hair loss is extremely common. Actually, a fair proportion of patients who present to me come with hair loss. Some people even imagine that they have a lot of hair shedding when there is actually no cause for concern. So I would say about 50% of females at during their lifetime will experience hair loss. And it is important to realize that one can lose up to about 80 to 100 hair a day. This is because there is always a balance between how much of hair is being formed versus how much of is being shed. So this balance can sometimes change, and therefore when the shedding is more than the amount that is being formed, you may notice that there is excessive hair loss. So as I said, when people come to me, I always tell them, do a hair count. See how much you are losing. Collect a day's hair loss into a bag. You collect whatever that comes onto your hairbrush, whatever that falls around you, whatever you find on your pillow in the morning, and then when you count it all, you collect it into a bag and you count it all. Up to 80 hairs a day can be considered normal. That doesn't mean that you're at a given time you're going to lose 8 hairs always, but up to that point, 80 to 100, we consider as a normal hair loss as well. So it all depends on actually, how significant this hair loss is, because just because somebody comes and tells me I have hair loss or alopecia, it doesn't necessarily mean that there is significant hair loss in that person. So beyond that, as you get older, obviously your hair production is going to slow down and your hair shedding is going to increase. Therefore, anybody who is beyond about middle age, 40 years, you're going to have more hair loss than when you're a younger person. Certainly, once you go into menopause, it's a big event in your life, and that causes a significant hair loss in females. Then those who do various hair practices like hair straightening. This hair straightening is referred to by many terms depending on the amount of straightening that is done. It's called bonding, rebonding, keratin treatment. All these are different types of hair straightening. Straightening of hair generally causes, you're pulling and breaking the bonds that are keeping your hair in that straight form. And therefore, hair straightening is one of the main causes of hair loss that we see in women. And this is a recent trend, straightening wasn't around 2 decades ago. So because it's being practiced so much nowadays, we see a lot of hair shedding or hair loss due to straightening practices. Similarly, if you perm your hair also, if you have dandruff on your scalp, that is also another reason for hair loss. Yeah, so this also depends on the age group that we are referring to. So as I mentioned previously, postmenopausal ladies experience what is called patterned hair loss. But on the other hand, this patterned hair loss can occur due to slight hormonal imbalances. There is this condition called polycystic ovaries syndrome, where there is an imbalance in the female hormones, where there is excessive activity of the male hormone. Because everybody has the male hormone and the female hormone in the body. Even females do have it. But where the male hormone becomes more active, that also causes a patterned hair loss. Now, this patterned hair loss actually can show in different ways. It's a certain pattern. So in females, but the commonest way it shows up is where your central parting begins to gradually widen. So little by little, the central parting becomes wider and wider. In some ladies, you may find the 2 temples, the hair in the 2 temples here, those also can show recession. So if you have hormone imbalances, even as a young person, if you have this polycystic ovary syndrome that I referred to earlier, you can have this same patterned hair loss. But mostly you would see it in the older age groups. Okay, then if you don't see, so pattern hair loss, when I look at the patient, I examine and I see the patterned hair loss, and then I would pursue the investigations in that direction. But on the other hand, if you don't see anything like that, where the hair loss is kind of overall, you have to think of underlying conditions like certain deficiencies. The main vitamin that can cause deficient hair loss is iron deficiency. So we would do certain investigations to check out for that, and we would address any deficiency accordingly, any iron deficiency. Also, zinc is a very important micronutrient for hair. So zinc deficiency is also known to cause hair loss. Vitamin D plays a big role in hair formation, and therefore that is another cause of hair loss. And remember, not like the previous days, nowadays everybody wants to look fair. Nobody wants to go out in the sun. Therefore, vitamin D is made in our bodies when we expose to the sun. When our skin is exposed to the sun, we manufacture vitamin D. And because people don't go out in the sun anymore, there's a lot of vitamin D deficiency around in the population, and this also can be a contributory cause. Sometimes it's not just one cause. It's a combination of causes which give rise to hair loss. Then also there are some hormonal issues that can cause hair loss, particularly if your thyroid is underfunctioning. We call it hypothyroidism. So if you have a deficiency of your hormone thyroxine, this is another well-known cause of hair loss. There are in thyroid deficiencies, not only do you get hair loss, the hair that you do have also looks very unhealthy, very listless, it has no character. So along with that, there are of course certain other features of thyroid deficiencies. And if we do suspect thyroid deficiency, we would do a test to see whether there is a deficiency, and then replace that hormone accordingly.
And what sort of tests are usually done, doctor, to diagnose if you've experienced hair loss or are experiencing hair loss?
Yes, there are certain tests, but tests are not necessary in every patient. It all depends on the type of hair loss that you are dealing with. There are some simple tests where you can just do what is called the hair pull test and see whether there's a lot of hair coming out. I mean, there's a scientific way of doing it. I will not go into details. Then there is an instrument called the dermoscope, where we use it to magnify the scalp. Especially these are used especially where you're suspecting some scalp disease as well. So where indicated, we would do a dermoscopy, or when it's done on the scalp, we refer to it also as trichoscopy. Then, as I said, if you are suspecting certain deficiencies, you would do the relevant investigations like the iron levels, etc. Or if you're suspecting a hormonal issue, you might do the thyroxine level. Then, beyond this, there are certain tests which are particularly invasive, where we might even have to go to the level of taking a biopsy from the scalp, where you're thinking of or where you're suspecting certain serious diseases that I spoke to you about previously. We may even go on to doing a scalp biopsy, where you take actually a piece of scalp under local anesthesia for testing, for pathological testing.
So moving on to a question I'm sure most of our viewers have been waiting for, which is on the treatments, medications, and supplements that could be taken to actually treat hair loss. Could you touch on that a little bit, please, doctor?
All right. So I'm sure by now you will realize that there are so many causes for hair loss. There is no single way of treating hair loss. First of all, you need to diagnose the cause of it. And depending on the cause, we will address the treatment. So we use a combination of methods to treat alopecia. One of the main ways we treat it is with something that you apply on the scalp. This is called minoxidil. I'm sure people have heard of this. There are different percentages of minoxidil, especially useful for the pattern hair losses I spoke about. If there are vitamin deficiencies, vitamin supplements that you need to give, but there are certain hair supplements which are pretty useful in hair loss issues. Out of treatment that we use internally, sometimes we have to modify the hormone balances. I spoke about previous people with polycystic ovary disease or certain imbalances of their hormones. In those patients, we would use either a drug called spironolactone, or also referred to as aldactone, or sometimes the contraceptive pill is very useful in restoring the imbalance that females can have. Sometimes there is a certain form of the contraceptive pill called Dian 35, which also is very useful for those who have overactivity of their male hormone. So beyond this, the treatment becomes more and more complicated for those who. So we would do this in a stepwise manner. We don't rush into these more invasive ways of treating just because you have a little bit of hair loss. You first treat with the more simple ways, then you go on to the more invasive ways of treatment. Now, one of the methods that people may have heard about is PRP injections. PRP stands for platelet-rich plasma. Platelets are a component in everybody's blood, and what we do is we take a sample of blood, separate out this component called platelets, and we re-inject it back again to the scalp. Because this is not only used actually in alopecia, this is used in many other diseases like joint diseases, etc. Because of these platelets being rich in these growth factors, they have a stimulatory effect on hair growth. Of course, there are advantages and disadvantages. One is the pain that you have to put up with when you are having PRP injections. PRP can be also done with a little machine. It's called the derma pen. We instead of injecting it with a syringe, we can use the derma pen, which is less painful. Also, the drawback here, of course, is the cost, because this process of extracting your platelets needs a certain machine, and this whole procedure, therefore, is a bit costly. And PRP may not produce results with one treatment session. You may have to repeat sessions. What we generally recommend is a monthly session, once a month. At least 3 sessions should be done to see whether it's helping. If there is no response after 3 sessions of PRP, there isn't much point in going on with this method. Final methods of treating very severe hair loss is hair transplantation. This is practiced, of course, more with males than in females, but there is a place for hair transplant even in females. Again, the issue here is the huge cost involved with hair transplant, and you have to have it done at a place where it is being done well, because hair transplant is a very complicated and which has to be done accurately, or else the results can be disastrous. So you need to go to a center where it's known to be done well. So if one is considering hair transplant, you need to read up about it, do your research.
Is there any side effects to these treatments that you just mentioned?
Certainly, every treatment has some side effects, I would say. I mean, nothing comes without side effects. If you take minoxidil, one of the issues is it can cause irritation in some people. So some people just cannot tolerate minoxidil. And minoxidil is something that you have to go on with on a long-term basis. You can't just use it for a short period to get results. You have to use it for at least 2 to 3 months to see the results. Sometimes you may get even unwanted hair growing in other places, like facial hair may start growing with minoxidil, in which case you have to quickly discontinue it. And with minoxidil, sometimes when you stop, you may even get an excessive hair loss. This doesn't happen often. Often what happens is, if you stop minoxidil, whatever hair that got retained due to the effect of minoxidil starts to shed, and therefore people think you're shedding a lot of hair after minoxidil. But on the other hand, really it can cause a paradoxical effect where you shed more hair than normal. So out of the oral treatment that we use, I mentioned that we can use hormonal modifying therapy also. These can have rarely effects on your libido and your sexual functions. So these are to be kept in mind when you are treating with hormonal therapy. So regarding this oral treatment, I need to mention that some of these supplements can give you side effects like gastric irritation, a bit of gastritis. Iron supplements can also give you constipation. So if people are prone to gastritis, they need to take it with some medication towards protection against gastritis as well.
So, Doctor, given the COVID-19 pandemic we are still going through, something we've heard often actually quite recently is post-COVID hair loss. Is this really a thing?
Absolutely. Definitely. In fact, that's one of the commonest side effects or after effects of COVID that we come across. And this hair loss actually comes into the category of telogen hair loss that I spoke about previously, where I said the hair shedding occurs with a gap of about 1 to 4 months. In COVID, it comes actually very quickly. It starts maybe about 2 to 3 weeks after COVID, and it can last for a couple of months actually. And this hair loss can be very, very severe, so severe that it can cause actual, baldish looking scalps also. Also, I must mention these days we are having a lot of dengue as well. Dengue is also a cause of this type of hair loss. So both COVID and dengue can give this kind of telogen hair loss.
So, Doctor, how does one stop post-COVID hair loss or post-dengue hair loss, or are there any treatments that we could take if we experience this?
Okay, so there is no way you can really stop it. It's not everybody who experiences this type of hair loss after COVID, but certainly the moment you do find it occurring, you can start the treatment very quickly. most of the time we would give minoxidil as an application and some good hair supplements which need to be continued for a couple of months.
And lastly, doctor, would you be able to share some tips with women dealing with hair loss?
Okay, so I would say the first thing you need to do is do not freak out. Okay, you may be having a hair loss. If you start stressing out about it, this can further contribute towards hair loss and this can set up a vicious cycle. So seek help. There is treatment always for this kind of thing. There's no need to get depressed. Now, as I mentioned earlier, some of these straightening procedures can contribute towards hair loss, and if you're doing it very, very frequently, you need to think seriously about giving up that kind of hair straightening procedure. Also, when you're using shampoo, you need to use the correct shampoo for your scalp. In the market, you know that shampoos are labeled as being for oily hair, for dry hair, for damaged hair, etc. So you could choose your shampoo accordingly. But if you do have any disease like seborrheic dermatitis, you have to use certain shampoos which help to take away the scales. There are scalp conditions called psoriasis where there is very heavy scaling of the scalp, and for those there are special shampoos which are based on tar. Those are called tar-based shampoos. So you would want to use one of those for a person who has psoriasis. You need to use a general shampoo.
Thank you, Dr. Gunasekara, for this very informative session. I'm sure many of our members as well as viewers here would benefit a great deal from this discussion. And I would also like to thank Lanka Hospitals for collaborating with us on this initiative. Thank you, everyone, and have a great day.